Hello everyone. Today I will be presenting on an operational analysis of the manufacturing process of the radiofrequency needle. So to dive right in, what is radiofrequency ablation? So this is a procedure used to reduce pain. An electrical current is produced by a radio wave that is used to heat up a small area of nerve tissue, thereby decreasing and eliminating pain signals from that specific area. The RF needle is used to provide pain relief as it burns the sensory nerves. This is most commonly used in the back, the neck, and arthritic joints. The pain relief usually lasts anywhere from between 6 months up to a few years, depending on the patient. The reason it's only effective for this period of time is because it targets sensory nerves, which have the ability to grow back over time, even after they've been burned. So many people use this form of pain relief because it's considered safe and non-surgical with a very low risk of complications. Typically, you'll arrive at the doctor's office and they'll lay you on your stomach or your back. The doctor will then numb the area with the local anesthesia and proceed by inserting the RF needle into the area of pain. He will use an X-ray in order to find the exact area, and then a micro electrode will be inserted through the needle in order to send radio frequency currents into and actually heat up and burn that nerve ending. So after the procedure, typically they tell you to take it easy for 24 hours, but then after that, you're able to fully return to rigorous activity and driving and stuff like that. So next, moving on to the process map. I tried to simplify it a little bit, but it's pretty complex, so I'll try to walk you through it now. So it starts with the cannula, which is made out of stainless steel components such as iron, nickel, and chromium. These are melted down and extruded into the form of tubes. These tubes are then cut to length and angle grinded in order to produce that short tip that they have. Next, they'll be sandblasted and dulled in order to be able to attach the hub to it. Next, they'll go through dimensional analysis, which will measure AQL, which stands for acceptance quality limit, including outer diameter, inner diameter, sample size, length of the tube, length of the sandblast, and angle of the bevel grind. And then the needle will be shipped to America to the manufacturing contract, and here they will check the quality of the angle grind and sandblast, and then they will actually insulate the needle by spraying on an insulation coating. After the insulation is sprayed on, it needs to go through 2 rounds of heating, and then will be tested using high pot tests, which are high voltage potential tests, which use a very low current but a very high voltage, around 400 kilowatts, in order to test the upper limits of this insulation coating and essentially trying to break it to make sure that it can withstand everything. And next, it'll be counted and packaged and shipped to your final manufacturer, where the stylet will be added, and along with 2 electrical wires that will be added and an interface hub, which will be attached in order to match up with the doctor's reversible piece. And then lastly, you'll have the needle shipped to a sterilization company where it will be sterilized, packaged, and shipped back to the manufacturer on record, where it will be added to your finished goods section. From there, it can be shipped to any pain clinic you want or any doctor you need. So looking at some of our problems that we have is our manufacturing process is extremely long. This whole thing takes about 15 weeks total. We use 3 different manufacturing companies and 1 sterilization company just to make one product. From the supplier side or from the consumer side, this is also a product you can't really afford to run out of, because then you have to deny a patient treatment, which would be not something you would want to do. So it requires a lot of planning. To kind of combat this not wanting to run out, we recommend using your reorder point equation. So a typical pain clinic can use about a little over 3,000 needles per year. So I rounded this to 60 needles per week. Like I said, it's got an average lead time of 15 weeks. making your reorder point 900 needles. Of course, this doesn't include safety stock. So when we do include safety stock, using a 95% confidence level, you would want to reorder at 1,062 needles, and using a 99% confidence interval, we would want to reorder at 1,129. We highly recommend this so that you're 99% certain that you will not run out. I threw this in here just to get a sense of how many orders per year that would be. It would be about 7 orders, which is fairly frequent, so hopefully it should not be forgotten and you should never run out. Next, moving on to identifying the bottleneck, there's 4 different activities. You have needle production, which takes 9 weeks, insulation coating, which takes 4 weeks, adding your stylet, which takes 1 week, and your final sterilization, which also takes 1 week. One batch of needles is about 40,000, so each one, it takes them this time to go through the 40,000. Typically, you'll have 45 workers in needle production, 25 in insulation coating, 30 in adding a stylet, and 20 in final sterilization, which allows us to calculate our capacity and see that our bottleneck, which is defined as your lowest capacity, is our needle production. So some of our recommendations to combat this, from a consumer side, we really recommend that the hospital or pain clinic uses the reorder equations and use it at that 99% confidence level. This provides them the biggest confidence and the least likelihood that they'll run out of needles and not be able to treat a patient. From the supply side, we recommend that there's a couple different ways you can go out fighting the bottleneck. We think you could add staff in order to needle production where is lacking. You could redistribute your responsibilities, which kind of goes hand in hand, and combine your facilities. We'd really love to see them vertically integrate the whole process and be able to have one manufacturer do needle production, coating, and adding a stylet. You can't really include sterilization in this because this is highly regulated and certain companies have their expertise in it. If you are able to vertically integrate, you would be able to make the whole supply chain more connected and actually move down towards that lower right-hand column of Hayes and Wheelwright matrix, which would make you more efficient, hopefully produce more needles per year, and in the end, hopefully make more money. So in conclusion, we kind of feel that this is an amazing product and is here to stay, but they do not have an optimal supply chain. Like I said, we'd really love to see it vertically integrated over the next couple of years in order to make the supply chain more efficient and connected in order to sell more and make more money. So if you have any questions, please put them in the comments below. I'd love to answer them further. Thank you and have a great day.